Hello, welcome to the 2014 Notice of Funding Availability for the Program Competition of the Continuum of Care. My name is Gary Greer. I'm with the Coalition for the Homeless as a project manager. Welcome to today's webinar and guidelines. The agenda for today includes the FY 2014 CoC Program NOFA highlights, the application submission, scoring and ranking, new projects, which includes reallocation and also PSH bonus, ranking grievance procedure, and a review of attachments and forms. We are excited to have this opportunity to bring additional housing and services to our community.
Hi, I'm Eva Thibodeau, the Director of Programs with the Coalition for the Homeless. We act as the lead agency for the Continuum of Care. I'd like to share a few of the highlights and some information specifically about the fiscal year 2014 Continuum of Care program competition. Two exciting things. For the first time in a while, there will be up to around $3.5 million available for a new permanent supportive housing project in our continuum. Also, your eSNAPS application for renewals should be a little bit easier because data from the 2013 application has auto-populated in the 2014 application. The requirements for applying for fiscal year 2014 funds are contained in the 2013-2014 CoC competition NOFA that came out at the end of 2013. So the NOFA applies to both 13 and 14. There are very few updates, but we will go over the things that are different. There are 4 categories available for funding this time: renewals, new projects that are created through reallocating non-renewing projects, CoC planning, and bonus money. HUD has been very clear that Continuum of Cares, particularly the lead agency, must review all new and renewal project applications. And they asked us to be very thorough to make sure that people who are going for new applications are eligible for the project component type, that the proposed activities are eligible under the new interim rule through the Hearth Act, that the narrative fully responds to the question and meets all criteria for that question, that data in various parts of the application are consistent, and that the required attachments correspond to the list and that they have complete current information, including an updated date. To this, we will be taking your applications, reviewing them very thoroughly, and then sending out any kind of edits, additions, or feedback that we have for you in time for you to make those edits, return them to us so that we can meet the deadline for submitting this application. So HUD has not changed their priorities. They are the same as what we were able to talk to you about at the FY 2013 project competition. It remains ending chronic homelessness as their #1 thing. And they really target turnover in permanent supportive housing units, increasing your beds whenever you can, and utilizing housing first so that, again, which is a model of assistance that doesn't have preconditions such as sobriety, minimum income, or service participation requirements in order to truly reach down and serve the most vulnerable people who are out there. Ending family homelessness, particularly rapidly rehousing households with children who are currently on the streets or in emergency shelters. They ask CoCs to do very strategic resource allocation. They specifically say in the program NOFA that each CoC must review all projects within its geographic area using CoC-approved scoring criteria and selection priorities to determine the extent to which each project is still necessary and addresses the listed policy priorities. Funds for projects that are determined to be underperforming, obsolete, or ineffective should be reallocated to new projects that are based on proven or promising models. They want us to focus on removing barriers meaning that coordinated access is required as the way for everybody to get into housing from here on out. And they want us to continue to do transitional housing review to make sure that our transitional housings are using evidence-based practices, that they are using promising models, that they truly are reaching the difficult to serve, and that their outcomes are at least at threshold with what HUD is looking for. They ask us to maximize the use of mainstream services and also to build partnerships with our public housing authorities and private philanthropy in our communities. They were very clear and specifically pointed out that new projects may not accept people coming from transitional housing. And they made a clarification in this that people in transitional housing are not and will not be considered chronically homeless, even if they met the criteria prior to entering transitional housing program. What HUD is trying to say is that if someone is in transitional housing, it is the responsibility of that transitional housing project to exit them to nothing other than permanent housing. We will be using eSnaps, the online electronic submission for the CoC program application submission. We need all applications to be submitted via eSnaps at or before 5 o'clock Central Time on Friday, October 3rd in order to be considered for the competition. Late applications will have negative scoring points and they may not be considered for funding. There are additional documents that you will need to submit, scanned and signed, and those also are due at or before 5 p.m. on October 3rd, 2014, and those certifications can be sent to our project manager, Conchetta Skirbo, and her email is listed here.
I am Takesha Richardson, the HMIS Senior Manager with the Coalition for the Homeless of Houston-Harris County. I am going to go over project scoring and ranking. Scoring and ranking are two separate processes. Scoring will help to inform the ranking of each project, but is not the sole determinant of a project's rank. Other factors that can determine a project's rank is HUD's FY2014 priorities as published in the CoC program competition NOFA. Additionally, the CoC Steering Committee can prioritize each project based on the needs of the community to best serve the homeless population. The CoC must assign a unique rank to each project that it intends to submit to HUD for FY2014 funding. HUD strongly advises CoCs to rank higher those project applications the CoC determines are high priority, high performing, and meet the needs and gaps as identified by the CoC. The HUD performance thresholds are as follows. 80% of permanent housing residents remain in permanent housing or leave to other permanent housing. 80% of those exiting from transitional housing exit to permanent housing. 20% of all participants have employment income. 54% of all participants have non-employment income. And 56% of all participants obtain mainstream benefits. Please note that the CoC system-wide information submitted with the FY2013 consolidated application will be evaluated for fiscal year 2014 competition as well. The CoC program scoring is as follows. Prioritize turnover dedicated units to chronic homelessness. Housing stability. 80% remain in permanent housing or exited to transitional or permanent housing into permanent housing. At least 75% of permanent supportive housing applicants indicate that they will use the Housing First model. The jobs and income growth. 20% or more of participants had employment income. 54% or more participants have non-employment income. And 56% or more participants obtain mainstream benefits. According to HUD, HMIS data quality standards, projects must retain information in accordance with standards. And supportive services only grants that are not utilized for coordinated access are not eligible for renewal. SSO grants not utilized for coordinated access will end on the last date of your fiscal year 2013 grant cycle. The CoC scoring tool was approved by the CoC Steering Committee at the public meeting on September 11, 2014, at the recommendation of the FY2014 NOFA Strategy Committee. According to the CoC policy, outcome data regarding performance will be generated by HMIS APR information. Scoring of renewal projects will be completed and presented to the CoC Steering Committee on October 9, 2014. The CoC lead agency will generate APRs directly from HMIS on September 22, 2014. The FY2014 NOFA Strategy Committee will present recommendations to the CoC Steering Committee for approval at regular meeting on October 9, 2014. All projects approved by the CoC must be ranked as Tier 1 or Tier 2.
New projects. Please note the requirements for new projects created through reallocation and those applying for permanent housing bonus funds are different. New projects must meet the specific requirements for either bonus or reallocation funds. Applications or applicants can apply for new projects for bonus and or reallocation funds, but must submit separate applications for each type of new funding requested. If the project does not meet the specific criteria for either the bonus or reallocated funds, they will be rejected. Only one permanent housing bonus project may be submitted by the continuum of care. This bonus project must only serve chronically homeless households. Projects should be for 1-year terms and can request funds for tenant-based rental assistance or scattered site leasing. Operating or construction may be considered based on the application, and also supportive services. The maximum funding amount is $3,595,900. Applicants are encouraged to apply for the maximum amount. New projects created through reallocation. The amount of funds available for reallocation will not be final until the renewal evaluation process is completed. Reallocated funds may be used for new projects that, number 1, create new permanent supportive housing, or 2, create new rapid rehousing projects serving families with children who enter directly from the streets or shelters. Note, 100% of the beds for permanent supportive housing must be dedicated to chronically homeless individuals and or families. Although HUD will allow new projects to request grant terms of 1, 2, or 3 years, the continuum of care strongly encourages applicants to seek only a single year of funding, as this will maximize the new units for the continuum of care. Please see new project application for additional clarification. Applications may be obtained by emailing the Continuum of Care lead agency at cscarbo@homelesshouston.org. This completes the new projects section of the webinar.
Hi, this is Eva Thibodeau again. I'd like to introduce to you the grievance procedure for this application process. HUD has outlined the times at which a grievance may be filed and for what concerns. They cite improper application of rules, regulations, and procedures concerning participation in the consolidated grant application process, improper interpretation of these rules, regs, and procedures, disparity in the application of the rules, regs, and procedures, violation, or if you want to dispute the score assigned by the renewal scoring tool or ranking and prioritization policy. And you can see the FY2014 NOFA for additional guidance on this. The CoC lead agency will be notifying everybody who applied of final ranking position by October 16th of 2014. The deadline to then submit grievances based on this ranking is going to be October 21st, 2014. In order to file a grievance, you can follow up with Conchetta Scarbo, one of our project managers, at the following email address. The additional documents that are needed are listed on the following slide. The forms that you need to submit electronically to the coalition are numbers 1 through 4, and the following ones need to be submitted via eSnaps. Please verify that the dates on all the documents are current. And if you follow this link, you will be able to find copies as available of the additional documents. Thank you so much. We look forward to working with you during this process, supporting you as needed in order to complete it in a timely and fantastic way to bring this much needed money to our community.